GP blood results. If you're wondering where to start your health journey, a good place to start is with your GP and get a full blood count done with your GP. It's important to get it done once a year to keep an eye on what's going on. So it's also important to understand what to ask for, because sometimes a lot of clients come to me and the GP blood results form a big part of the consultation. There's loads of information in there and it's to understand what those different markers mean. But oftentimes clients go to their GP and rely on the GP to test, while if you understand what you're asking for, you can ask for certain markers to be tested and then you're in control of the information rather than having to go back again afterwards for more information. So your GP will do a full complete blood count, and that include your liver function, your kidney function, red blood cells, white blood cells. That's all great, but there's other information you need. You need a full iron panel, and that includes your iron levels, your TIBC, your transferrin saturate, the amount your red blood cells are saturated with iron. In addition to that, make sure and ask for your ferritin, B12 and folate. And with those full iron panel and the ferritin, B12 and folate, you have the complete picture of what's going on. It's really important for both male and female, but especially for females who are menstruating, to understand where their iron levels. If your ferritin is below 100, you could be having symptoms of low iron. If your ferritin is above 200, you could have too much iron. And in that incidence, it can be quite problematic. So you might need to be tested for hemochromatosis. It could be inflammation, it could be a genetic mutation. So it's very important to understand those markers. Then next, it's important to go on an empty stomach. First thing in the morning, book your appointment, fasting from the night before, for your blood sugar levels and your cholesterol levels. Your blood glucose is what's the glucose in your blood here now, but you also want to ask for your HbA1c. This is the amount, the blood glucose over the last 3 months. It attaches to the red blood cell, which lives for 3 months. So you want to ask for the HbA1c, and it's an indication for type 2 diabetes and how you're managing your blood sugar levels. Really important. Cholesterol, we all know about cholesterol and we're all checking our cholesterol levels a lot of the time, but not quite understanding how to manage them. So you're going to have your LDL, your HDL. LDL is considered the bad cholesterol, HDL is considered the good cholesterol, where you get from your olive oil, your nuts and seeds, your oily fish. It's important to have that as high as the LDL. But don't panic if your cholesterol is too high. There could be other things at play. You could have a low thyroid. You could have low vitamin D. You could have low fertility. And because you're not making those hormones, your cholesterol has gone up. So don't panic. It's not always the case you need a pharmaceutical drug to manage the cholesterol. You need to look at your health and see what's going on. Only 20% of cholesterol comes from our food, and it's our repair hormone. It's our hormone, it's our repair hormone, and it makes our hormones. So it's very important to keep it at a certain level. Then you have your thyroid. Now, thyroid is our engine. It makes our energy, keeps us warm. Very important to keep an eye on the levels. So TSH, the thyroid stimulating hormone, and the T4 is usually what's tested. But I'd like to see the T3, and if possible, the reverse T3. The T3 is the active hormone. The reverse T3 is what happens in times of stress and low nutrients, where the thyroid might go low. So see if they will do those. Then the hormones, especially for females, but not necessarily for. You want the follicle stimulating hormone, the estrogen, the progesterone, and the testosterone checked. Ensure to ask. There's no point in just testing the estrogen and maybe the follicle stimulating hormone without the progesterone. So ask for all the levels to be checked. So if you're trying to determine your fertility, if you're thinking of getting pregnant, you want to go on day 3 or 4 of your cycle. So day 1 is the first day of your period. Then on day 3 or 4, you want to go to your GP and get all your hormones checked to determine your ovulation. Are you ovulating? Then if you're going into menopause and you want to check your hormone levels, you want to go between day 18 and 22 of your cycle. Now, what's a very good idea is to get a full hormone panel, maybe in your late 30s when your hormones are still good and you haven't started to go into perimenopause, so that you understand what your hormones were when you were in good health, just in case you need HRT. down the line. Now, not all symptoms for women in their 40s are related to HRT. It could be iron deficiency, it could be low thyroid, and that's why it's so important to get all these numbers done to see what's going on in the body, okay? And then vitamin D. Now, I don't know why, but here in Galway, they're not inclined to test for vitamin D. It's really important. I don't like supplementing unless your levels are low. So vitamin D is hugely important for immunity, for our mood. It's also very important if you have an autoimmune disease or maybe osteoporosis where you're not absorbing your calcium. Vitamin D helps absorb calcium, but too much vitamin D can be problematic as well. So don't assume, always test. So I hope this is beneficial. If you recently got your GP bloods done and you don't understand them and would love to learn more, drop me a PM or info@slaunchawellness.ie, and even remotely we can have a chat about it and analyse those results, looking at your symptoms as well, and come up with a plan for you. So I hope this helps. Take care.